Bell's palsy is the paralysis of facial muscles, which is caused due to the inflammatory condition of facial nerve. So first of all, we should know about the facial nerve. Facial nerve is the seventh cranial nerve that is arise from the medulla oblongata. The function of this this nerve is to supply the muscles of face and has both the sensory and motor function. So this nerve has both the motor and sensory function. Now we have to discuss about its branches. So there are 5 branches of this nerve. 5 main branches are frontal branch, zygomatic branch, buccal branch, mandibular branch, and cervical branch. So these are the 5 branches of facial nerve, that is 7th cranial nerve. So we have discussed about the 7th cranial nerve, that is facial nerve, and Bell's palsy as the paralysis of facial muscle that is supplied by facial nerve, and any inflammatory condition of that nerve can cause Bell's palsy. Why it is called Bell's palsy? Because this was first observed by the British anatomist named Charles Bell. So why it is called Bell's palsy? Now we are going to discuss about its signs. What signs we can observe in patient with this condition. First of all is ptosis, which means dropping of eyelid. Second one is absence of nasolabial fold. Nasolabial fold is the fold which is present between the nose and the cheek. So in this condition, this fold become smooth and absent in patient with this condition. Another one is the dropping of face and lips margin on the affected side. So, due to the weakness and paralysis of the affected side muscles, these signs can be observed. Now, symptoms. What symptoms will be present by the patient? The patient present the symptom that mostly the complaint of the patient is unable to eat properly, This is the basic complaint of the patient. So now we are going to explain its causes, that what can cause this condition. Causes. So this condition, first of all, we can say that it can be present without any underlying condition. So we can say that it can be idiopathic. Next, we can say that this can be caused due to the otitis media, which is the inflammatory condition of middle ear. So other conditions can also cause Bell's palsy, like rhinitis, these can be the causes of Bell's palsy. And we can also say that any trauma, any physical trauma to the facial nerve can also cause Bell's palsy. So next we are going to start the treatment, that what can be the prescription for this condition. In medication, we should, first of all, we should treat the underlying cause of this condition, which can be otitis media. So in that case, we can prescribe antibiotics, which can be penicillin or any other group of antibiotic. We can treat that condition, and with these type of medication, with antibiotics and NSAIDs. We should treat the underlying cause first of all, which can be any viral infection and can be a bacterial infection. So we can treat them on the basis of that underlying cause. After that, we can prescribe cortisol, which is a glucocorticoid for this condition and helpful in the management of this condition, and can also prescribe vitamin B12, which is present in the form of mecobalamin, present in the market with different product names. Medication, other type of management steps are also present nowadays, in which one of the most important is the physiotherapy management. It is the most important one and can manage this condition. So in physiotherapy, we can apply electrotherapy modalities, in which EMS is one of the important one. EMS is the electrical muscular stimulation. Electrode of EMS are placed over the branches of the facial nerve, which can rehabilitate and stimulate that nerve. Another step in the physiotherapy is PNF techniques, which is proprioceptive neuromuscular facilitation, which is applied over the affected side and can be a good step in rehabilitation. Other things in physiotherapy is blowing air in a balloon, which is strengthening exercise for the facial muscles. And other is reading vowel letters which are A, E, I, O, U. So we advise to the patient that speak these letters A, E, I, O, U. So these are the management steps for Bell's palsy. So that's enough for today. Thank you so much.